For those who have never met me, you may have seen me on some recorded webinars, but it may be the first time you've seen us live. My name is Eric Auger. I'm the Director of Research and Development here at American Business Systems. Listen, without any further ado, I'm bringing Patrick on. Patrick, it's time for you to join us here this afternoon. Thanks for joining us. You've had a busy day already because you've been at that live training workshop.
Yes, the hotel that we do the training at is right out by the DFW airport, which is about 20-30 minutes at the most with traffic from our offices here in Keller. So I went over there today and kicked off the marketing section. Now, Eric, everybody thinks that the learning the software is the hard part of doing this business and all the details of doing medical billing, but it's getting clients that's the tough part. And we're right up front and honest about that and teach about a dozen different ways for people to go out and market and get their first client. And if people just do what we tell them to do using one of those methods, they will get that first client. And then if they do a good job, all their business will come from referrals. All
Absolutely.
The doctors know one another.
And that's one of the things that you kind of kicked off today was the marketing part of it. So it's interesting to know that the CEO of American Business System, who you work with a lot of prospects getting into the business, you're actually working with our licensees after they become a licensee, even at the training workshop. So you kind of started the whole marketing campaign, the learning aspects of it today.
Yeah, and that's because I did go out and actually try to market to doctors. This has been over 20 years ago, when my wife was starting her business, and I did have to do a lot of things that, well, let me just put it this way. You don't want to do what I had to do to learn this because you'll spend a lot of money and a lot of time and be very frustrated if you try to do it on your own. Now, we've worked it out in the last 23 years how to do that. And as you're showing there on the screen, my son Adam, of course, is now the president of the company. And even though he's never been out actually talking with doctors, he's worked in the business since he was like 12 years old. So he knows every aspect of our business and talks with licensees on a daily basis as well.
Let me say this to everybody, that we have done a full-hour webinar on what to expect when you do come to our training workshop. You can find that on our YouTube page. You just go over there and just type in training workshop, and you'll be able to find that. But we'll be doing another one of those on that topic probably in the next few weeks anyway. But if you want to kind of learn a little bit about that, just go back and like I've got right here, you can probably look for this particular title, Start Medical Billing in 5 Days, Guaranteed, in our YouTube channel. You can find that very easily there. Before we jump way far into this webinar, let me let everybody know that we have this entire slide presentation in a PDF, and it's over in your handouts. So those that are present today, if you'd like to, you can go over there and download that, follow along with us, or print it out for later. You can share it with your partner, your spouse, whoever else you might try to get some investments with like that. But all of that information is going to be right there. But Patrick, everybody showed up today because they want to know what kind of income they can expect in medical billing. I mean, obviously, you got to know what you're kind of getting into, and then what kind of return on investment could I get maybe with my first client?
Yeah, well, Eric, I know you're going to show some slides a little bit later where we go into our income calculator, so I want to save what I'm about to say mainly for that slide because it has to do with the disclaimer. Because, folks, anybody who starts talking to you about income and a business opportunity or franchise, you need to take everything that they say with a grain of salt. Because really there's no guarantees that anybody can make money in any business. And if anybody guarantees you that, of course, you should run as fast as you can. Now, we have a money-back guarantee at the end of our training workshop. If you don't like what you've seen and think it's not the right business for you, you just ask for your money back, which is very unusual in today's world. But we know what we have, and we know that once people have gone through that training, they're pretty pumped up and thinking, you know what, I can make a lot of money at this. Now, that's why today, with this disclaimer, I'm going to tell you that the figures we're going to show you is not what every licensee makes. It's not the most money that licensees make or the average amount people make or the least amount that somebody makes. They're just numbers. But they are taken from what we hear from our actual licensees and the reports we get on the number of claims that they're doing. So we kind of have a feel for it.
Yeah, absolutely. And folks, you can run these numbers yourself, not just on our income calculator that, as Patrick said, but if you want to do a little due diligence, I mean, everybody's gone to the doctor. And Patrick, you and I were talking about this before we got started. Anybody that goes to the doctor is expected at least to pay $100 for that particular visit. So at that point, you can kind of use that as your base for understanding at least what the doctor's getting. And if you got that, then you can kind of start running the numbers as we'll show you today. But again, let's talk about, Patrick, a lot of folks, obviously, they're going to invest, and our investment here with us is $25,990. That's $26,000. And again, that's not just, pocket change for a lot of folks. People are investing maybe retirement money, maybe money that they've saved, maybe money that they've taken out a loan on. And obviously, they want to know how to get that money back as quickly as possible and how to replace that $25,990. And I believe what we'll hopefully share today is, in most cases, and again, we say this as a disclaimer, in most cases, with one doctor, you should be able to see your return on investment in the first year, which really beats everybody out there in any type of business model that you'd ever see.
Yeah, in fact, the unique part is that our investment, even though it may sound high when people first run across $26,000, that's low. Eric, if you look on the franchise websites, you can spend $500,000, $2 million, $3 million for some franchises. So $26,000 is not a lot of money, but it's enough to make people stop and think, what if I don't earn that back?
Right.
I mean, that's a possibility in any business. Well, here's how you can not earn it back. Come home from our training workshop and put everything on the shelf and don't do anything.
Right.
You will never get that money back. But if you follow instructions, if you can follow our system that we've laid out for the last 23 years, it doesn't take but one client to make that investment back. As we said earlier, that one client can lead to a lot of others just from referrals. So
yeah, you got it.
So show us how we can make the $25,990 back.
We're going to do that. First of all, we got to set the stage, Patrick, because obviously everybody wants to know, first of all, in any business that they're going into, and you coach people on this all the time, is there a market for what you're trying to get into? And what we're going to do here real quickly, folks, and this is good information of why you want to maybe go download and have that PDF of what we're showing you right now, because this is a great resource for you. But as we start looking at, the big full picture of healthcare, which includes hospitals, doctors, health care spending, even down to dental services, which obviously a lot of people ask us, do we do dental? You can address that too. So Patrick, you want to kind of talk through these numbers here as we kind of go through this particular slide?
Yeah, so here's the way I think of it. $614 billion, man, I just want a little small slice of that pie.
Right.
It doesn't take a whole lot of pie of that kind of money to make you a decent income. So, even though it's a small part of that, if you look at that pie, of course, dental is only 4% of that. And folks, that's because most people don't have dental insurance.
Right.
Dentists don't see near as many patients as doctors do. So it's just not as big a market. There's just not as big a market. I tell people, go out and do what we teach you to do, to sign up all the MDs, the doctors, the practice assistants and nurse assistants and practitioners. And once you've signed all those up in your area, then you might think about going after a dental client. But it's just not big enough to worry about, and you don't want to have to learn two different systems. See, dental billing, they use a completely different software system. It has to have the ability to take x-rays and do all kinds of stuff. So we just don't get involved in that part. But look at the other pieces of the pie there. You've got, your home health care, and then you've got nursing care. All of that's wide open. Of course, physician and clinical care is 20% of that pie. So it's a huge slice of that $614 billion that we're trying to tap into. I think the last number I saw, Eric, was there's almost 983,000 medical providers in the United States.
Yeah.
It's a big market.
A big market. So much, it's big enough that it's gotten, it's obviously Entrepreneur Magazine puts out start your own medical claims billing service.
Yeah.
And I think you've got actually a copy of that in your bookshelf there. But as Patrick's looking for that, folks, you can see there that the market for medical claims billers is growing exponentially with again, a big pool of providers, expanding patient pools, healthcare industry spending expected to grow by 5.8% each year through 2024. And then it says by then healthcare spending will be 5.43 trillion and account for 19.6% of the gross domestic product. So as we get down to it, Patrick, I mean, it's a huge growth step in the right direction.
Yeah, it says, let there be no doubt, healthcare is big business, and its growth shows no signs of slowing. This makes it the perfect time to start your own medical claims billing service. Here's that book. You can get it off of Amazon. Entrepreneur Magazine's been around about 40 years, publishing books like this. And Eric, I think you know this, of course, but we might even show the fact that we are in the book. Now, we didn't even know we were in here till we bought the book, but somewhere in here it actually lists us as one of the resources for business opportunities. It's right here in the index under medical claims, software, clearinghouses, and business opportunities. So, folks, Entrepreneur Magazine is a very reliable magazine, very trustworthy. When they say that something is a solid business and actually take the time to publish a book on that particular business, you can bet that that's something worth looking into.
Yeah, absolutely. And we certainly recommend you getting the book. I mean, as Patrick said, go on Amazon. I mean, it's a lot cheaper than $25.990 at the beginning, but you can see the investment that you would have to make if you were trying to do it all on your own. It would actually cost you more than that. And you don't certainly get the support that you get from us. I mean, you'd have a book there, but it does give you some good information as you're starting to do some due diligence.
Yeah, that's a good way to put it, Eric. For due diligence, this is a great book. Now, it doesn't have enough in here for somebody to really go out and get their business started because you need some hand-holding, you need some support, you need a network of people behind you like us to really go out and know what you're doing and seem confident when you're talking to doctors. But it's a good start, and for $15 on Amazon, that's worth looking at least. Yeah.
Yeah, and Debbie's asking the question, great question that we can address right now. She's asking, what are the main struggles for a person that doesn't have a medical experience? Well, it's just learning. That's all it is, and that's what we do here, and that's why not only do we talk early about the live training workshop, because we've taken people that know nothing about medical field or anything. In getting that, but we also have many other resources besides just the live training. Patrick, I think every week we do continual education for all of our licensees, just about every single week in another go-to webinar that we do on Fridays.
Yeah, we do these on Wednesdays, of course, for people who are looking at getting into our business, and some of our licensees actually attend these too because we do give new information every week, but they also come to our Friday webinars that we do for the licensees because, folks, this is an ongoing thing. You're going to be learning for the rest of your life, and we're going to keep you up to speed on everything like you need to be kept up in this business to be competitive out there.
You got it. And drawing from another third-party resource, and folks, again, we're giving you our resources that you can do your own due diligence, but Black Book Research is a third-party separate from ABS. We don't have any affiliation with them. But Doug Brown, their managing partner of Black Book, states this: rising healthcare expenditures is creating an urgent care demand for cost-effective, technically advanced business office outsourcing solutions in the physician's practice across the country. Now, what is he talking about there? Well, he's talking about outsourced medical billing is expected to report an overall 42% growth over quarter of 2016 all the way to 2019. Patrick, that's 42% growth for medical billing companies.
And that's in only a 3-year span there from the time this survey was done. What's amazing to me is that people don't realize when you get in business, you need to get into a business that the line is going uphill, not downhill. There are some industries right now that I would not get into. I wouldn't get into a car dealership, for example. might not even get into real estate right now. But the point is, medical billing is one of those staple type businesses that have been around for, well, at least 25, 30 years. And it's going to be around for a long time because this is how the doctors get paid. They have to bill the insurance company and Medicare to get their money.
And so, as you can see, folks, we're not going to belabor and just kind of reread this information. Again, we've put this in your handout that you can go do your due diligence. You can see across the top of here on this particular slide, we've got the URL. So go research this yourself. Revenue cycle management is medical billing. So anytime you see RCM or revenue cycle management, it is medical billing. And again, this just came out at the end of last year. But it shows, again, these forecasting of the growth in this particular industry. You've got folks like Mike from Avia Code that keeps saying that physicians could increase their monthly billing by 30% if their coding was done accurately, which leads me to the question, Patrick, that Tapan over here asked, do I need to know medical coding?
No. The great thing is, guys, well, this is the big deception that's out there on the internet and so forth, is that people are saying, oh, if you want to become a medical biller, you have to be a coder. You know, you have to know about all those codes, numerical codes that have to do with the procedures and the things that the doctor does to the patient. That's not true, folks. And we've proven that over and over again because we have dozens of people that I've interviewed that you can listen to their interviews on our YouTube channel, and you'll see that they all say, most of them, that they didn't have any training, any background at all. And if you ask them outright, call someone. We'll give you their numbers, won't we, Eric? I mean, after the end of this, go back to the person who sent you the email to this webinar and say, hey, I want a list of references. Let me talk to some of your people that have been through your training. They'll tell you. They'll tell you I didn't have any background at all. In fact, the lady who's teaching our training this week down here is Cynthia Anderson, and she's been with us now for about 8 years or 9, maybe going on 9.
Right.
She had no background whatsoever, didn't know one thing about this market, and now she's got 12 employees. Yeah. Did I tell you that, Eric? She has 12 people working for her now. That's how she takes off a week and comes down here and does the training, because she just communicates with them through her cell phone, you know, during the week. But the great thing is that you've got somebody teaching you in these classes that are actually building their business as well. And I think that means I pay her a lot of money to come down here because I don't want you and I going up there and just saying, now here's what should work out there. I want to know what really works. And if it doesn't work, we get rid of it. If it does work and we come up with a new idea from somebody, we incorporate that into our training and share that with our licensees. Because, Eric, as you know, we make money not just on the licensing fee, but from our technology partners. Behind the scenes, we make a few pennies on all the transactions that go through our system.
You bet.
So that's why we're anxious to get everybody as successful as possible.
And last thing we want to say is, obviously, everybody knows the New England Journal of Medicine. This is a publication that comes out, goes directly out to doctors, and their statements are that, again, we're asking the question, is there a market for this, and why would a doctor want to use you in the first place? Because obviously, before we start to show you the income potential, we've got to address, is there a market, and would a doctor even want to use you? And Patrick, we can talk about this because we're about to get into percentages of what people are going to make. And here's a great tie into that, because it is said by market analysis that it's estimated that 24 cents out of every dollar are wasted on administrative and billing expenses. Well, again, sorry, I went to public school, but I think 24 cents out of a dollar is 24%.
That's right.
That right. So if you can imagine, that's what doctors are spending to get their billing done, 24% to get a claim out the door.
Yeah, that's if they're doing it in their own office, because I don't know of any medical billing company out there that would charge 24%. The doctors would just say, get out, you know, I'm not going to talk to you. But the doctors don't realize this number. If they did, they would at least consider outsourcing it to somebody who's only going to charge 6 to 8%, let's say. That's what our licensees charge for this. For the money that's brought in, you're only charging 6 to 8%. Compare that with 24%. So the doctor can save a lot of money. Not only can we bring them in more money and reduce their rejection rate on those claims way down, but we can also save them money on the actual filing of the claims.
You got it. Cassie, I see your question, and I think we've got a couple of slides towards the very end that we're going to answer your question, but just for you, in case you have to leave us, to answer your question, the answer is yes. And I'll just say it so I don't hold everybody captive here. She was just asking, is our software set up for ICD-10? Well, that's one of those medical codes that Patrick was talking about there. That is the diagnosis code. That's what's wrong with the patient. That's the identification of the diagnosis. That's what that is. That's version 10. To do billing nowadays, your software has to be set up for ICD-10. We were ICD-10 ready way before it ever went into effect, and so that's the only way that any of our medical billing companies actually right now are actually processing claims. So the answer to that, yes.
And Debbie, the great thing is that we update those codes when they come out with new ones. They're updated in your system at no cost to you. By the way, we have certified medical coders who make sure that those codes that are in our system are up to date.
You got it. All right, so let's dive in now. We're at the bottom of the hour, Patrick. We've got about 30 more minutes, and I think this is going to give us plenty enough time to kind of run through these numbers. Obviously, again, this is a great time for us to state the disclosure. What we share with you now are just numbers. Obviously, we cannot guarantee these numbers, as Patrick said, but we can get pretty doggone close. I have to say, this is a good estimate for you to kind of work your numbers through. So, Patrick, I think the best thing to do is just kind of let's just look at, first of all, if we're going to be doing this billing thing on our website, you've had our web team design this on our web page. This title right there where it says income potential. You've had that up there for quite some time, and it's been pretty accurate.
Yeah, we haven't had any feedback at all. People tell us that they put in their own numbers. As you'll see, we have some numbers in there that are when you go there, but you can also put in your own numbers. And they said, I got out my calculator, and sure enough, it seems to be working just fine. It's showing me really what kind of money that I can make. So go there and do this on your own, folks, and you'll see the numbers come out of what we're going to show you here today. Yeah,
matter of fact, we're going to show you this as if we're going through it. So this is where it's going to land you. How much do medical billers make? You can see, you can put the number of doctors, the number of patients that a doctor will see in a day's time, the average number of days the doctor's office is opened. Then you'll see the percentage of what an average claim is, and then we're going to just select $100. So Patrick, we're really kind of just staying with some basic numbers. I mean, obviously we don't want to blow the numbers out, so let's just stick with one doctor. Our example that we're going to show is if we were billing for a general practitioner. I think you and I were talking again earlier. If we go see a general practitioner, if we're paying cash, we're not getting out there for less than $100, if $150. So we're well within the range here of where we're talking about how much a claim is worth.
No, absolutely. This is, in fact, we've been very conservative on these numbers, Eric.
Yeah. And then we know about the number of patients that a doctor sees because it feels like anytime we go to the doctor, there's probably 25 patients in the room at that particular point of the day. So it's average, folks. These are average numbers. So let's press this submit button, and you'll see the return of what you would make with this scenario. So Patrick, I mean, with one doctor, someone could be working at home and making just about $40,000 a year.
It's probably just me getting older, but I can barely see that number on that screen. Eric, can you blow up your screen in any way? I don't know if that will increase that or not. If you did,
I don't know. But let's do something even better. Let's really break this thing down. We'll do it this way. So let's see that this doctor is seeing 25 patients at $100 a reimbursement, because that's, if we're talking, revenue cycle management or certified medical revenue manager, let's call it what it is in our world, which is a reimbursement back to the doctor. So this is the money that the doctor's expecting to get back from the insurance company which includes Medicare. I mean, Medicare pays about an average of $100 per visit for a regular doctor. You know, at the end of the day, Patrick, if that doctor is seeing 25 patients a day, he or she's expecting to get about $2,500 per day in return volume of money back in that time, which for a lot of us, we think, man, that's $2,500 a day. That's a lot of money. But considering what a doctor has to take care of, that's probably very, very low.
A big portion of that might go back to paying back his medical school bills.
Yeah.
But, oh, yeah, they have an overhead, they have lease, they have insurance, they have employees, of course, and benefits and materials that they have to buy. It's very expensive to run a practice. But a doctor could probably make a fairly decent living at that rate. So
right.
Some of them are happy with that kind of volume.
Yeah, 25. But there's some things that we could do to help that doctor increase that. So again, there's this expectation, everything that's on the left-hand side are the insurance companies, including Medicare. All that money gets transmitted back to the doctor electronically. And we've got it kind of illustrated this way because, Patrick, a lot of folks ask, as a brand new person trying to get into medical billing, do they have to handle the money? You want to address that real quickly before we get off this screen?
Yeah, well, we don't let our licensees, and we as a company don't get involved in the doctor's cash flow. We want it to continue on just like it always has been, and that is the claims are submitted to the insurance company and to Medicare, and they issue a check or deposit directly in the doctor's bank account the amount of money that those claims represent, usually once a week.
Yeah. Yeah.
And so then our licensees simply use our system to come up with the number, the dollar number that they collected for the doctor that month. Let's say for the month of August, it says we collected $150,000. Then you just multiply that times the percentage that you agreed on with the doctor, and we'll show you how to come up with the pricing. And that's the invoice number for that doctor to pay.
You got it. And so using these numbers, if a doctor is getting $2,500 a day, and their average billing days are 20 days a month, well, folks, that comes out to $50,000 a month in expected revenue. Well, that's $50,000 a month to the doctor, but you were the one that helped them get there. And as Patrick said, you're going to charge that doctor a percentage. And if the average is 6%, remember this; those are the numbers we used in our illustration in our chart there. So the doctor has to pay you that 6%. So you got $2,500 a day times 6%. Your average earnings on that per day, you're going to be making $150 a day. Now, here's the great question. How long did it take you to do that? Well, less than 90 minutes. Patrick, you want to kind of talk that through? Because for some people, that's like, wow, that's pretty good part-time money so far.
Again, all of these numbers that we're giving you, folks, you don't have to take our word for it. Ask some of our licensees, what is it that you actually take time-wise to file a claim? And Eric, I've never heard more than 2 minutes for a claim, even if it's a brand new one. And if they're using our electronic medical record system where the doctor's information is gathered and put into our system, it can be less than 30 seconds for a secondary visit if the patient's already been there before. The initial visit might take a little longer, but the point is, we've said that they're seeing 25 patients a day. That's 25 claims that they have to file, and literally at 2 minutes a claim, 3 minutes a claim, that's 75 minutes, isn't it? So
right.
It doesn't take long. Now there's other things that you do in a business to run a business, but for the actual work that you're doing here, that 150 is pretty decent.
Right. For that amount of money. Then if you take that out times your week per week, and then we take that 52 weeks out of the year, there's where you get that $39,000. So we've really broken it down as best as we can, not just letting you put numbers in a website and then pressing submit, and then it pops out this number, and you go, how in the world did it get there? We've broken this down as easily as possible as we can. So, folks, your average earnings, working 90 minutes a day, an hour and a half a day, could return $150 a day for you, $750 a week, making it $39,000 a year. And again, we're trying to be as conservative as we can because, Patrick, we also know, I mean, a doctor could see more patients. I mean, so there's a lot of variables there, but we're trying to get the lowest common denominator there as we can have.
Well, and let me remind everybody that these numbers are just based on what we see actually happening from our licensees. We know these numbers are accurate. We know they're conservative. Now, whether or not you as an individual could earn that or not, we don't know, right? It's an unknown because everybody has their own skills and their own background and all kinds of things. But from what we're doing in this 1 week's training, believe me, you're ready to go out and sign up a client. And,
Yeah.
and Eric, let me remind everybody that this is based on $39,000 is for just one doctor.
One doctor. Yeah, one doctor.
Yeah.
So, again, let me remind you where to go. Go to our website. Go to the income potential. Use your numbers. I mean, you may be seeing a doctor right now, and you know, man, Patrick, Eric, I know my doctor is at least seeing 35 patients a day. Put that number in there. Maybe it's less than that. And here's a good thing for you to do whenever you're into this, because I want you to start thinking proactively. Because a lot of folks, Patrick, they want to know, well, can I do billing for a chiropractor? You can, but you're going to put that number in there. They may be seeing 40 patients a day, but the average claim amount may only be $50. And here's what I want you to think about. For the same amount of time it takes you to put in a claim for a chiropractor could be the same amount of time it takes you to put it in for a specialist, maybe a cardiologist, maybe a podiatrist. But you'll find out that their return may be $175. So do the math there. You can spend more time trying to put in a whole lot of claims for a lot less money, or you can put in less claims for more money and get a bigger bang for your buck there as you're kind of walking through that. So again, there's that number. Patrick, we got about 20 minutes here, but let's kind of talk about who they could actually bill for. I know that a lot of people ask, you know, what does my market look like, and who can be my client? So we kind of go through this list, and I know Adam kind of goes through this on day one of the training class as well.
Yeah, and there's so many specialties out there, guys, that you could literally Google medical specialties, and you'd probably come up with much more than this. I think you probably have even more screens than this, but there's a good example right there, folks. That's what, maybe 22 dozen different specialties. And Eric, I think I could probably figure out what most of those are, but there might be some specialties that I don't even know. I don't really care. All I care is that doctor collecting everything that they should be collecting? The answer is no, and I can solve that problem.
You know, the great thing about it is, and I brought this up in our training class via a webcam just this week, and you may have heard me say this, Patrick, on there, that it doesn't matter if you're dealing with doctors that are specialties like this that we're looking at through here, or whether it's a general practitioner. You really, at the end of the day, when we're doing billing as we're going through these, at the end of the day, the doctors, for us as medical billers, they're only seeing two types of patients. They're either seeing a new patient or an existing patient, because this gives us a huge advantage because we don't have to know particularly everything about their specialty. What we need to know is, doctor, you seen a new patient? Because if it's a new patient, guess what? We get to get you reimbursed a little bit more than if you've got an existing patient. And we need to make sure we've got that information in that system there correctly. So it's really it kind of takes that fear factor in whether I can do billing for a specialty or not.
Yeah, because if the codes are all in there, and if the doctor gives you a code that doesn't seem to be right, it will tell you that. In fact, it will tell the doctor that while they're seeing the patient. It will suggest the codes that they should be using. So it's ingenious the way this was designed. And folks, this is leading edge, cutting edge technology, the latest cloud-based stuff that's out there, and it's updated on a regular basis. I mean, like once a week, you know, our programmers behind the scenes are improving and tweaking the program and making it better and better all the time. We've won all kinds of awards, but the thing I want to emphasize is, folks, you're not really selling the software, it's your service. And that's why what we're going through right now is important, that you know that you can make money at this because you're providing a very valuable service the doctor needs.
Absolutely. You know, Patrick, we've got another question in here from Jim, and Jim's asking, well, can you run the numbers on somebody that might be a specialist. And I'm glad you asked that, Jim, because that's actually leading into where we're going next here, because I think that's what we'd like to see. So, Patrick, I mean, obviously we talked about a general practitioner, but if we were looking at this from a specialty standpoint, you know, again, we're trying to be conservative. I mean, obviously, as you and I get older, we've known each other now for 10 years, so we've known each other. We know that we go to the doctor, but we know when we go to see a specialist, it's going to be $200, $300 easily.
Oh yeah, and that might be a good point to point out, Eric, that they might see the same number of patients as a general practitioner, but they get to bill more because of the fact that they're a specialist, and sometimes those bills are $300, $400, $500, but what they actually get reimbursed from the insurance company is usually less than what they bill for.
Good point there, Patrick.
So we're using numbers here that are the numbers that you would actually be collecting from the insurance companies that would actually be reimbursed to the doctor.
So get this, if a general practitioner is seeing 25 patients and their average reimbursement is at 100, again, we just kind of kicked it up just $75 more for a specialty. So again, think of your specialties out there. I mean, podiatry, that's your foot doctors. Your urologists, those are the guys who are going to be taking care of kidneys and everything going on like that. Cardiologist, gosh, all the specialties that we were listing there. We're going to take the same amount of patients. The only number we're changing right now is their reimbursement. So we're taking $175. Now, you know, it's gone from $2,500 a day to $4,375 a day, again, to the doctor, okay? So we're going to use those same numbers. Again, $4,375 again gets deposited back to the doctor. But again, you got that $4,373 at an average of 20 billing cycles a day for a month. That's $87,500 in expected revenue. Now, you can almost already hear the wheels turning with everybody on the webinar. Your expected outcome for the same amount of work will be exponentially greater as you're kind of going through this. So let's run through these numbers here. Again, the doctor has to pay you for managing their money and processing those claims. So we're going to take that $4,375 per day at 6%. At this time, now you're making your your average earnings $262 a day for 90 minutes of work. Same amount of work, same amount of time. The only difference is working with a general practitioner to a specialty. This is the average bump that you're going to get. Over $250 a day, Patrick, for working an hour and a half. Run these numbers throughout the year. $262.50 times 5 times your 52 weeks, $68,250. For a lot of folks, Patrick, this is really all they ever need.
Yeah, I tell people, look, just in your mind, you know what you want to make or have been making, right, on your regular job. So just do the math to see what comes out. How many doctors do you need? I bet it's not more than 2 or 3 for most people.
Yeah.
By the time
a lot of people think, well, gosh, I'm going to need to have 10 doctors to do billing for. Folks, you can keep this as a part-time business. Even if you had 2 specialties and you said, enough is enough. That's all I want. How hard is it to make a 6-figure income at that point? 2 doctors working about a half a day.
Yeah. And we've got licensees who do that, Eric. They don't want to get any bigger. They like working out of their home in their pajamas or traveling and running their business as they travel with a laptop. It's a great home business. And Eric, this has been called one of the secret or hidden home businesses that are out there, because you may have heard of medical billing, but how many people do you actually know that actually do the medical billing for a doctor? Probably not many, if any. And so, and yet the kind of money that can be made, Eric, I think that's why people who do this keep it very quiet, don't you?
There's no doubt. There's no doubt. And folks, if you think about it and put it in perspective, you know, if you think about it, if it took you even 2 months after training to get a doctor, but you knew this was your target, this is what you were working towards, the investment of your time, your effort, the $26,000 that you don't have to go reinvent the wheel on everything, and then this becomes your you talk about residual income, and I love what you say, and I'm gonna let you say it. You don't have to sell lotions, potions, or whatever. I don't know how you say that.
No, you don't have to sell potions or lotions or pills or cassette tapes or anything else like some of the multi-level marketing companies do. And yet this has the residual draw of those businesses, Eric, because look, assuming that the doctor's continuing to see patients, you're going to continue to make that $1,312 a week, week after week after week, unless you help the doctor build their practice,
right,
which we have services that do that, and that means the doctor would see even more patients. So your income would go up even more.
So, folks, just as we kind of start wrapping up this afternoon, we've got about 10 more minutes here, and I know there's a couple of questions here towards the end that we want to work towards. But, folks, a lot of people start asking us now, well, how do we line up with the competition? What about our competition? What about ABS's competition? And then what is my competition whenever I get out there? Folks, where we separate ourselves from everybody else is our technology. Patrick, I think we've done an incredible job here at ABS to partner ourselves with medical technology that just blows out the competition.
Yeah, and one of them we're looking at right here, of course, is the magical iPad. I have one here that I use when I'm monitoring. So I don't know if this is going to show up or not, but I'm actually monitoring our webinar live here on my iPad. We take this in and encourage our licensees to get an iPad, take it into the doctor's office, and show them this technology, because once they see it, they're blown away. And if they don't want to do that, Eric, they can have our people, our staff, do a live demo for them too.
Absolutely.
You've done a couple of those this week, haven't you?
Yeah, absolutely. And so a lot of people ask us about our competition and how we separate ourselves and why use iClaim and EMRX. Well, it's because what you see here, folks, it has everything that you would think that a doctor's office would need. It kind of goes back again to, I think, one of the questions that I think Cassie was asking earlier, is our system set up for ICD-10? Well, again, you can see here, it's been around since 1998. We're here to stay. It's in every specialized mode of medicine that you can think about. It's totally integrated. It's all web-based. There's nothing you have to do. It's 100% customizable for these doctors. And if you look over here on the left-hand side, it's U.S.-based customer service. It's everything that you would ever need. And Patrick even mentioned a while ago that it has met so many awards and it meets so many criteria out there for whether it's security, for patient information, whatever it might be. It's meeting all the every aspect and blowing away the doors off of most medical billing systems out there already.
And although you'll be using the system, of course, in your office to do the billing for the doctor can utilize that iPad to actually get the information from the patient. And guess what? As soon as the doctor is putting some of that information in, or the front desk is gathering some of that information, it's in the system. So when you log in, boom, all that information is there ready for you. Somebody asked that question, so I thought I'd just throw that in. That's how you get the data. The doctor is actually putting that in, or the staff for you on the EHR side. Yeah.
Patrick mentioned earlier about the different services, and that's just the iClaim and the EMRX is one section of how you can make money off of this. And I think, Patrick, you even suggested that we need to kind of go break each one of these down in another webinar, and we'll start working on that. But this is kind of just the suite of information of services that you have here. And we had to put a physician's toolbox because we'd have this whole thing filled up with all different services.
But we start coming up with new services, right?
So we just put it all in what's called the physician's toolbox over there, and so there's a lot more things that we can do. So what I'll do, Patrick, I'll just kind of run through a few of these here.
If you can just hold up on that, Eric, just for a second. I want to address some of the questions that are in the box there before we get to the end of the webinar there.
Right.
But, one of them is just one here from Debbie. She says, would we be licensed in all 50 states? The short answer to that, Debbie, is yes, although there is no nationwide licensing for a medical billing company. The certification we give you when you're down here in that 1 week's training here in Dallas is all the certification that you need. That's all the licensing you need. Now, there might be a license for a business that you open up in New York or Chicago, that you have to go to the county clerk's office and register the name of your business. You might think of that as a business license, but all the billing in the United States is all done the same. It's using the same system, the same forms, the same insurance companies, so you don't have to worry about that. You can do the billing for doctors in all 50 states. And we have licensees who do billing for many, many doctors in different states, because you get referrals, you know, from another doctor who knows another doctor outside the state.
You got it.
All right. And that's...
Any more of those questions there, Patrick?
Yeah. Jakob says, how many weeks is certification? It's actually during that 1 week of intense training. We call it a mini MBA in medical billing. We do that all in a 40-hour week. Now, there's other study and training and behind-the-scenes stuff that you have on our private licensee website that you'll continue learning. So it's not all done in that 1 week, but it's a way to get your business off and running, and we've got licensees who leave that training and go out and get their first client in the first 30, 60, 90 days, which is great. But there's always something else to learn, so the certification goes on.
Yeah, you got it. And then he's asking one more question. How many staff would I need to hire? Well, I guess that would depend upon really how many doctors they're doing billing for. If you're dealing with one doctor that is a specialty and they're only seeing 25 patients a day, you may not have to hire anybody. You can do it all by yourself.
Well, yeah, as you saw from that one doctor, you're making $68,000. You may not want to hire anybody else or have any more clients, but assuming that you have a smaller client and a handful of them, you could still come up with the same number and make that kind of money with 4 or 5 doctors, right? Depends on the volume of claims. But at some point, everybody just has this inner gut feeling, oh, I don't want to do any more claims. I'm going to hire somebody to do that part of the business for me. And then you can hire them as a contractor who works for you without, employee benefits and all that stuff from their home. About this, okay? Here's the book that we're going to talk about next week. We're going to go into detail about how you can utilize this book as a marketing tool. Unheard of, Eric. Nobody in this industry has anything like this, because as you can see, folks, you can put your name as having written the foreword to the book. Now, we've already written the book. We've already written the foreword, and we just put your name on there. You have our permission to write the foreword. Or you can write a new one if you want to, too. But the point is, you become a part of a book with a doctor. Look, Dr. Vicki Ragnar is right there on the cover of the book, and your name is on that book. Eric, it does not get any more credibility-wise. It doesn't get any stronger than this right here, to be on a book with a doctor. Yeah. And your contact information, Eric's showing it there on the screen, but you can see the title page has your name on it. And then even at the end of the foreword, which is just 2 pages, there it is, you see? That's the information for your company. So the contact information is right there in the book. And you'll see that you buy these books from us at our printing cost, which is about $4 a copy. Eric, this is the best marketing tool anybody has ever come up with. Now, on the web, this retails for $24.95. You'll see it right there in the corner. And you can go to Amazon and see that. And we price that way because doctors look at things that cost more money as being more valuable. Yeah. And so even though it's a paperback book, $24.95 is the price for doctors who want to learn how to thrive in private practice. And we're going to go through that book next week with Dr. Ragnar, who used to be a general surgeon. She's retired now, but she saw thousands of patients. And Eric, I'll tell the story as to why she outsourced her billing. I don't know if you've heard this story, but it's pretty strong.
Right. Well, folks, here it is. We've got the link over there for next Wednesday, how to engage with physicians. If you're looking and you want to know how to get your first client, be here next Wednesday at the time, wherever your time zone is. Be sure that you're here and get signed up for that particular webinar. Patrick, we're almost right up at the top of the hour, so I'm going to put up this information here. You mentioned earlier about our money-back guarantee. Why don't you talk with us about that, and then as soon as you can kind of get that wrapped up, I'll put our training date up for October.
Okay. I always like to emphasize this, Eric, when I talk about this, that there's no weasel words in this guarantee. This is right out of our agreement, and I want people to see that we can't weasel our way out of this. If at the end of the training week, for any reason, you don't think this business is right for you, and you'd be the only one that can decide that, right? then you simply tell any staff member, and they'll arrange for you to get a full refund of your license fee. That's right. Every penny of that $25,990 is returned to you, folks, if that's what you want by the end of the week. Now, how can we stay in business offering a guarantee like that, people ask? It's because people don't ask for their money back, not after they see what we've got. In fact, they want to give us more money at the end of the week, Eric, and I'm open to that.
We're open to that. We're all open to that.
All right. But the point is, folks, that only you can make that decision, and we let you make that decision. Now, during that week, we've given you a lot of handouts, books. We've given you the proprietary information. All of that you get during the week, and you can still ask for your money at the end of the week. So that's pretty strong. It's the best way for us to know that we're only getting the people who really do understand and want to do the business.
You got it.
We have had that ask. We have had refunds, Eric.
Sure.
I'll be honest about that. There's a handful of people over the 23-year period that have asked for money back, but it's always for a very, let's say, personal reason, like a guy who might come to the training and not tell his wife that he invested the money. He might be asked to bring that money home. You know what I'm talking about there, Eric.
Or don't come home.
All right. Or don't come home, right.
All right, so folks, obviously, we're just giving you information. We're not pressuring you into coming. We do have 2 training classes left for the end of the year. Obviously, we've been here for 23 years. We're going to be here, for a long time. So we've got a long haul. Adam's a young man, and we're in good hands. We've got a great staff. We've got a huge team of licensees that work together. So we're going to be here for quite a long time. So just if you're looking to invest in a company, investing in yourself, and investing in the future of a good business model, especially a business of growth, that is in the medical billing field. Join us here at our next training workshop. Give us a call here, 866-565-8413. Talk with the person that brought you to the webinar. That's your business coach. They'll do a lot of work with you, a lot of work for you, of helping you learn everything you need to learn, see the demonstration of the software, and then sign up for next Wednesday's webinar. I mean, you got a great opportunity. Hear a doctor, hear Patrick, and they're going to teach you for free, basically, how we're going to help you get doctors.
Now that's